It's been 2 years since we began living with a new normal. March 11, 2020 started like any other day, with the threat of the coronavirus only looming in the background until it wasn't.
CBS News projects Joe Biden the winner of the Democratic primary in Michigan.
Harvey Weinstein was sentenced in New York Supreme Court Wednesday to 23 years in prison.
Stocks plummeted after the World Health Organization changed its assessment of the outbreak.
COVID-19 can be characterized as a pandemic.
Bottom line, it's going to get worse.
We will be suspending all travel from Europe to the United States for the next 30 days.
The NBA took a major step suspending its season after a player from the Utah Jazz tested positive for the virus.
Seattle just closed its schools, the first major city to do so.
One of America's most beloved actors shared that he has been infected with the novel virus. In an Instagram post, Tom Hanks explained that he and his wife, actress and singer Rita Wilson, began to feel sick while in Australia.
With coronavirus now declared a pandemic, the U.S. and countries around the world are desperate to use new tactics to stop it.
Joining me now to talk more about this milestone and where we go from here is infectious disease specialist at NYU and Bellevue Hospital, Dr. Celine Gounder. She's also the host of the podcast Epidemic and editor-at-large for public health at Kaiser Health News. Dr. Gounder, it's almost hard to believe we're sitting here in person 2 years later. I've been covering the COVID pandemic since it began. We've spoken so many times, usually on Zoom, and here we are. Entering the third year of the pandemic, how far have we come over these past 2 years? And is this pandemic close to becoming an endemic?
It has been a really long 2 years. And I think it's important to start off by acknowledging the people we've lost, about 1 million people here now in the United States. But we really have accomplished a lot. We have multiple safe and highly effective vaccines, and we have a whole menu of other interventions, whether it's masks. We just had more studies from the CDC and NIH that came out this week showing that masks are highly effective. We have multiple therapeutics, so drugs that help treat people who have COVID, and tests. So if you remember, if you think back 2 years ago, we didn't have tests, and now we do. We have tests you can use at home. So we've really made dramatic progress over the last 2 years.
I remember the days of not being able to find a mask or gloves or a test, and here we are. As employers and employees get ready to return to work, as many states drop mask mandates, loosen restrictions, what should be expected and what's your guidance? It feels like people are hesitant, even in workplaces where masks are no longer mandated. People just, it's almost like, what's the courtesy? What's the correct way to behave?
One-way masking works, which means that if you want to protect yourself and you're the only one wearing the mask, as long as it's a high-quality mask, so an N95 or a KN95 mask, those will protect you. And I think we should be understanding that everyone has a different risk threshold. We're all a little bit different in terms of our medical risk factors and so on, and just be compassionate with people who do choose to continue wearing a mask. I certainly will be in certain settings.
We have to remember there are still very young children who can't be vaccinated, many people who are immunocompromised and still at risk. I want to talk about the Pasteur Institute in France, sharing evidence of this new variant, Deltacron, which has also been found in the UK and here in the US. What do we know about Deltacron? How transmissible is it? Is it much of a threat at this point to us here?
So Deltacron is exactly what it sounds like. It's a genetic combination of the Delta variant and the Omicron variant. And this is something we often see with viruses. They will recombine genetic material. What is concerning is that Omicron is by far the most infectious of the variants, Delta causing the most severe disease. And we don't yet know how Deltacron is going to behave. Is it going to behave like a combination of the two, and what aspects? I think the key thing to understand here is that the tools we have to fight COVID, from vaccines to masks to therapeutics to tests, all of that still work. And we have not seen the proportion of COVID cases really tilt towards Deltacron, at least not yet.
I want to turn to the youngest population that I mentioned, which I've reported on a lot. I was 7 months pregnant, sitting here on March 11, 2020. I have a 21-month-old son, so like many parents, I'm worried about him. And, you know, we started to hear good news coming out of Pfizer that we might have a vaccine for children 6 months to 4 years, and then the FDA paused that. What is the challenge Pfizer is facing with a vaccine for younger children? Is it a dosage issue? What's the holdup?
kids are not little adults, right? So they're smaller. They also have less developed, less mature immune systems. So a dose that's appropriate for an adult is not going to be the dose that's appropriate for a child. And really what you want to do is give the smallest amount that works. And I think what happened with Pfizer is they underdosed. They shot too low. And now they're having to readjust and study with multiple doses, with higher doses, just to make sure they get this just right.
I interviewed a mother whose 4-year-old child was a part of a Pfizer clinical trial. Her child received 10 micrograms like we have and did have side effects of mild fever. Do you have any sense if Pfizer is getting closer to a dosage that does work, or might children need more shots of a lower dosage?
Yeah, so adults get 30 micrograms. You have younger or teens who get the 10 micrograms. And then you get down to the really young kids, and they were getting 3. And, you know, again, you need to sort of adjust. It's sort of like Goldilocks and the 3 bears. And what is just right, we're still trying to figure that out. But I think we're getting pretty close.
Lots of parents hoping there are answers and possibly a vaccine for everyone by the start of the next school year. Dr. Celine Gounder, so nice to be here with you in person. Thank you.
My pleasure.